Is a husky child a healthy child? Well, Joe has the research to debunk this myth, and we used to think that a chubby child was healthy.
Shirley, for many generations, a healthy child was seen as a child with a healthy appetite, which meant that the child was thriving. Studies now show, however, that for many of these husky children, that a pattern of being overweight may in fact be becoming established at a very young age. So our debunk is lean is always best from toddler on.
And I think the reason this is something that it's hard for us to grasp is because probably a long time ago people didn't have an abundance of food, and so not only when people were skinny, that means they weren't prosperous. It also might mean that they weren't getting enough to eat, but that is not the case in our country.
Well, and it was such a challenge. I mean, I'm an Italian American, and when we came from and checked in at Ellis Island, came into the country, it was very hard to get work, and that's exactly what it was, Shirley. So when in the Italian population alone, when people started coming into their own and becoming successful and making a way for themselves in this country, one of the signs were you were able to feed your child. Yeah. And that's where this whole Italian grandmother, oh, look at that cheek, that's a nice fat little cheek. Right. I don't miss having my cheek grabbed, but I remember my aunts and my grandma and stuff like that, a chubby child was a healthy child. Yeah. And I don't think we're talking about if a child's chubby at 6 months, he's going to have a life of obesity.
Well, I was going to say, some babies, even on breast milk, some babies can be really skinny and some babies can be really fat. I used to tell my daughter, what are you feeding him? Whipped cream? I mean,
I think we're really talking more about toddlers, though, right? I mean, when do you start seeing, just to kind of pick up where we left off on this obesity thing, 3 years old, 4 years old, 5 years old, some of them have that baby fat and they lose it, but do you find that most of them, if they're significantly overweight at that age, do you find that that's becoming a pattern for their future?
Certainly, and and a lot of kids that I see, if they're overweight by age 4 or 5, you're already behind the 8 ball a little bit, and you've already lost some ground, because there's so many habits that are very firmly in place, even by the end of toddlerhood, that really it's a process of being healthy right from as soon as you introduce solid food.
Okay. Do you see this is I don't mean this as an indictment, but a lot of chubby children and kids who have a weight problem, are their parents sometimes overweight too?
Certainly. It's a family thing, and kids eat what their parents eat, and even worse, a lot of times parents eat what their kids eat, and a lot of kids' food isn't nearly as nutritious as or as healthy as the foods that adults would eat if their kids weren't around.
Interesting.
Well, you said something before the break that's, and I've heard before, but still alarming to me nonetheless. You talked about children getting diabetes. I think we might lose this label of adult onset diabetes because it isn't so much adult onset anymore. Can you tell our audience quickly the difference between type 1 diabetes, type 2 diabetes, and tell us how in the heck kids are getting type 2 diabetes?
They're really two totally separate diseases. Type 1 diabetes is a disorder where the pancreas fails to make insulin.
It's a genetic.
It's a sort of an autoimmune process where the body's pancreas actually stops functioning. In type 2 diabetes, what happens is your body sees so much sugar and it produces so much insulin over time that your body actually becomes resistant to the natural insulin that your pancreas makes. And you either need to supply more insulin or train the body in some way to reduce its dependence on that insulin that it's getting that your body makes naturally.
Now, what do you do with these children that are being diagnosed with type 2 diabetes? Is it more lifestyle changes, or do you have to treat them with insulin as well?
Well, the goal is ideally to identify a kid who is at risk, do some basic testing to make sure that they're not in any sort of full-blown diabetic picture, and then make lifestyle changes right there before diabetes ever develops.
Well, I have to say, this is so close to my heart because not with type 2, but with child onset. My little granddaughter Macy was diagnosed at 9, and she was the healthiest eater of all my grandchildren. She loved to eat healthy, but it doesn't matter. I mean, that's just something that happens. But this type 2, isn't it true that it's not just poor eating habits, but lack of exercise, sitting in front of the TV? Because years ago, not only, I mean, maybe we didn't eat that great, but we were out roaming around and playing from dawn till dusk. And now kids sit in front of video games and TV, and I think that has a contributing factor, wouldn't you say?
Oh, certainly. The whole spectrum of obesity-related disease, from the joint problems, the blood pressure problems, all the way to diabetes, is the two key factors. It's the food and it's the activity level.
I wanted to jump back for a minute, if you don't mind. We talked earlier about antibiotics and the overuse of antibiotics. One thing I always did with my kids, and I'm a firm believer in, even for adults, is the use of probiotics. In our intestinal lining, we have good bacteria and bad bacteria. Antibiotics are indiscriminate, correct? So do you advocate the use of probiotics, such as acidophilus, lactobacillus, and whatnot, to your kids when you're giving them antibiotics?
I do, actually. There's been some really interesting studies that have come out just in the past year or so that have really shown that the use of healthy bacteria is a safe and effective thing to do in kids, both to reduce the diarrhea that can be associated with antibiotics and the diarrhea associated with run-of-the-mill stomach flu. So all children that I put on antibiotics now, I recommend that they take at least some yogurt daily if the kid is willing to do it, to help protect the bacteria in the intestine.
It's great to see conventional medicine, Shirley, you know, integrating all these things. It's good to hear.
I love it. Well, up next, schooled in general pediatrics, Dr. Catherine Sunderbruch is up to date on the issues that are affecting our children today, and I'm sure you've already seen that. So after the break, we'll talk with her about how problems like asthma, obesity, and celiac disease have surfaced and are getting more common. So stay with us.